Why is fentanyl withdrawal so brutal? Fentanyl is powerful enough to alter your brain. The intense cravings, severe pain, and emotional roller coaster all come down to how deeply it can rewire stuff in your head. Why is breaking free from it such a massive challenge? Let's start with the basics. What exactly is fentanyl? Fentanyl is a synthetic opioid much stronger than drugs like morphine, up to 100 times more intense. It's commonly prescribed for managing severe pain like post-surgical discomfort or pain from advanced cancer. But because of its incredible strength, fentanyl is also produced and used illegally, leading to a lot of abuse. So what makes fentanyl so addictive? Like other opioids, fentanyl binds to receptors in the brain that regulates pain and emotions. When fentanyl attaches to these receptors, it floods the brain with dopamine. This is the chemical responsible for feelings of pleasure and reward. This increase in dopamine can create a powerful high. The brain quickly adapts to this, and what ends up happening is that your brain brings down its natural dopamine production. As a result, people need more of the drug to feel normal, causing them to depend on it. When these chemicals flood your system, they create a powerful sense of relief from pain. People call it a euphoria, often described as a high. Endorphins are great at dulling pain, which is why opioids are so effective as prescription painkillers. But they also have a sense of well-being, but not for long. As that high fades, the need to have that feeling often sticks around. This is where things take a dangerous turn. Chasing that same high again and again can easily lead to a cycle of drug use. This cycle can be very difficult to break free from. With continued use, your brain starts to rely on opioids just to feel normal. It's not even about getting high anymore, it's about needing the drug to function. This is the starting point of addiction. Over time, the need for fentanyl can become all-consuming, making it hard to focus on anything else. This is why breaking free from opioids can feel nearly impossible. Your brain is wired to believe it needs the drug to survive. Fentanyl is now one of the deadliest drugs in the United States. Overdose deaths, especially because of fentanyl, have been climbing up. Data shows that fatal overdoses from fentanyl spiked from around 70,000 in 2020 to over 80,000 in 2021, making it one of the leading causes of drug-related deaths. Withdrawal from fentanyl is particularly tough because the body becomes so reliant on it, and you already know how. When someone stops using the drug, their brain struggles to balance its chemicals again, leading to severe symptoms. This process is physically and mentally exhausting, often driving people back to using just to stop the symptoms. Did you know over 2 million Americans are battling opioid use disorder? Yep, you heard that right. As Dr. Sarah Wakeman, a leading expert in addiction medicine, puts it, people get trapped in a cycle where they can't feel normal or even function without opioids. According to her, they feel so sick during withdrawal that they'll prioritize over basic needs like food or even human connection. When someone addicted to fentanyl suddenly tries to quit or cut down their dose, the body reacts hard. The symptoms can be brutal. It's like your entire system is fighting back, and it's not pretty. Imagine trying to get through a day when you're dealing with all this at once. First, there's the nausea. It hits like a wave, sometimes leading to relentless vomiting and diarrhea. It's like your body is purging everything, and it can leave you feeling incredibly weak and dehydrated. Then, your heart starts racing, known as tachycardia. You can feel your pulse pounding in your chest, your blood pressure going up. This makes you feel anxious and on edge, like you can't catch your breath. Speaking of anxiety, it's a huge part of withdrawal too. Every nerve in your body feels raw, and the mental unease can make it nearly impossible to focus on anything else. Muscle pain is another issue, which feels like your whole body is aching and no position seems to make you comfortable. Insomnia is another crucial symptom. You're exhausted, but your body won't let you rest. Then there's the sweating. Your body temperature spikes and you break out in sweat only to be cold moments later. And no matter what you do, no amount of blankets seems to warm you up. It's an overwhelming experience. Your body is in complete turmoil and your mind is racing. These symptoms combine to create an unbearable situation where relief seems impossible, making the pull back to fentanyl even stronger. So, how can one manage fentanyl withdrawal? If you've been using fentanyl for more than a couple of weeks, it's important not to quit cold turkey. Instead, working with your doctor to create a safe plan to stop is key. Fentanyl withdrawal can be incredibly harsh on the body and mind. Having medical supervision during detox can make a huge difference. Withdrawal symptoms can be anything from uncomfortable to severe, and in some cases, other medications might be necessary to help ease the process. One of the most common methods to manage fentanyl withdrawal is tapering. Rather than stopping the drug abruptly, tapering allows you to slowly reduce the dose over time, giving your body a chance to adjust to the decreasing levels of opioids in your system. Your doctor will work closely with you to create a tapering schedule. This will be according to your needs, and this process can take weeks or even months. During tapering, regular checkups are common where your doctor will assess your vital signs, check for withdrawal symptoms, and even conduct blood tests to ensure the drug is leaving your system at a steady pace. This ongoing support is vital not only to ensure your physical health, but also to keep you motivated through the process, which can be emotionally taxing. Withdrawal isn't just a physical process, it also takes a toll on your mental and emotional well-being. Behavioral changes are another important part of managing withdrawal. Developing healthy habits like regular exercise, meditation, or journaling can help you process your emotions, reduce stress, and ease some of the physical discomfort during this transition. If you try to quit fentanyl abruptly and aren't able to manage the symptoms, you may be tempted to seek out illicit forms of the drug, which can be extremely dangerous. Illicit fentanyl is often mixed with other substances and comes in unpredictable doses, dramatically increasing the risk of overdose. Without regulation, there's no way to know exactly what you're taking, and a miscalculation can be deadly. This is why fentanyl overdoses have become one of the leading causes of drug-related deaths in the US. Withdrawal is never easy, but with the right support and treatment, it's possible to break free and start living a healthier life. Ultimately, managing fentanyl withdrawal is about patience and perseverance. The process is gradual, but with the right support, both medically and emotionally. And that's the end of this video. Do be sure to subscribe to our channel so you can stay connected with us. See you in the next one, and bye for now.